Now I'd like to move on from specific examples to the wider picture. And first, would you like to comment on the PREPARE study?
So what the PREPARE study did was they took a panel of drug gene pairs, which have very commonly used drugs, for example, analgesics, antidepressants, and they did a trial where they tested to see if people were tested for their genetic sensitivity, as it were, to these drugs, whether or not it reduced the likelihood of people getting adverse drug reactions. And what they demonstrated was that there was a significantly reduced likelihood if people were tested for these specific genes ahead of being treated with these medicines. So what this says is that there seems to be a really good case for introducing some routine testing, so some routine pharmacogenetic testing for these commonly used drugs into normal treatment, because you get the benefit out at the end of having reduced adverse events to particular drugs.
So that fills in some of the background. Now, you've given us some specific examples of where pharmacogenomics can help with the safe and effective use of medicines, but how can this be made part of a routine service? And who should be taking the lead?
The NHS is making huge strides to making it happen. There's the ambition is that the NHS will become the first health service in the world to introduce genomic medicine into the mainstream of healthcare. And pharmacogenomics is absolutely fundamental to this as a branch of genomic medicine. So there's a lot of work at the moment in terms of building the infrastructure. I think right at the beginning we talked about DPUID, so testing these new pathways, making sure that they work, and also building the capacity, because all of these tests, they need to be tested somewhere, and so we need to make sure there's enough capacity in our laboratories in order to deliver these tests. There's a question about whether or not, for example, should people be tested from birth, or only when there's a particular drug that's needed. So lots of questions still to be answered. I think that for pharmacogenomics in particular, then whenever I speak to other clinicians, other members of the healthcare profession, they're really clear that leadership for pharmacogenomics must come from pharmacy. And I think that there's a lot that we can do, because we understand the medicines. There is a lot of education and training that needs to be done in terms of understanding the fundamentals of genomic medicine and how that fits in. But we have a lot of experience of introducing new medicines into the health system, introducing new pathways, writing guidelines, and also talking to people about their medicines. We just have to add in the element of that genetic counselling element, and what do we tell people about that. The other side of this is a more general thing, which is understanding the cultural sensitivities, the importance of people's values and beliefs when it comes to genomics and genomic medicine, because it's not quite the same thing as saying we need to test your renal function before we test it. We provide this medicine. But what we really need to do is to embrace this, because it's not actually the future, it's here now. It's just going to get bigger and bigger and bigger. And so we all need to embrace it and to understand the value of this, and to be able to talk about it as normal standard care. And so that when people come to ask us, then we actually have an answer to give to them. And that really is what we're trying to do within the Genomic Medicine Service Alliance, to really spread the knowledge, spread the training, and encourage people to be familiar with pharmacogenomics and genomic medicines in general.
Very interesting. You've outlined where you think we might go with this, But what are the challenges that we're going to face on the way?
I think I've spoken already around the need for us to be to have some understanding. So that education and training element is really important. The other two parts that I would want to I'd want to describe really are, one is the fact that in order to be able to provide the correct and appropriate treatment for our patients, we also need to be able to interpret the pharmacogenetic report. And it does need a basic level of understanding of some fundamental concepts, and that really is the key thing that you need to know, so that when you see a report, then you can understand what it's telling you in order to advise the clinician or advise the patient on what it actually means and the implications for further treatment. And these reports can look quite daunting when you first look at them. But actually, after a while, you begin to understand and pick out the really relevant and important parts to speak to the patient about, or to inform yourself about in order to provide appropriate advice. The other bit, which is taxing people with far more expertise than myself, is really around the informatics element. So this at its very basic level is, we've done the test. What format is the information in? How does that information get into our patient record? How is that information shared, not only with other people treating the person, but also does that person or the patient have access to the information? How do they have access? And if they don't have, if they aren't particularly digitally savvy, then again, how do they get that information, and how is it shared, how is it protected, bearing in mind that the information about a person's genetic status stays with them for life. And so again, it's another consideration around making sure that the information is available, but is also held very, very confidentially, but people can use it when needed at any point in our patients' treatment throughout their whole lives.
Dr. Raliat Onatade, thank you very much for explaining this developing field so clearly. We look forward to the next chapter. For more information about Dr. Onatade's work, please follow the links in the description and be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.